So I'm just going to begin a little bit about the distribution and burden of malaria worldwide. I'm going to talk a little bit about the biology and the clinical details, and then I'm going to also speak about some control strategies. I'll talk a little bit about my current projects in Africa, and then I'll talk about the President's Malaria Initiative, and then I'll conclude with some statements. Next slide. So I don't know if many of you know this, but I think you do because it's been in the newsletter. So malaria was actually endemic in the United States. And here is a map from 1882, and you can see where malaria was likely located. But by 1951, malaria was successfully eliminated in the US. Other places in the world, however, are not as lucky as we are. So this map shows the global distribution of malaria today, mostly located in South America, in Africa, and Southeast Asia, as you can see. And so it's estimated that about half the world's population is actually at risk of getting malaria. So a pretty huge chunk of the world is affected by the disease. And the numbers basically speak for themselves. So in 2012, an estimated 207 million cases occurred worldwide. And this means approximately 6 malaria cases every second, and most of these occur in children. An estimated 627,000 deaths occurred, again, mostly in children. In fact, in the time that it's going to take me to go through this slide, 1 child will die from malaria. And so most of these cases and deaths actually occur in sub-Saharan Africa. Malaria costs us all a lot of money. $2.5 billion were given as aid in 2012 by international funders, used for things like bed nets, insecticides, testing and treatment supplies, and training. And because most of these cases occur in sub-Saharan Africa, there is a large economic burden felt by the countries where malaria occurs. And it's estimated that about $12 billion is lost every year from these countries. There's decreased economic growth. And then there's also increased spending on healthcare, especially by the household. And largely these are people that are already in poverty. So they're having to spend even more money when they get sick. So I think you've all known this from the newsletter, but just to remind you, malaria is caused by a parasite of the Plasmodium species. Here on the left, you can see a picture of red blood cells that are infected by parasites, and those are the purple dot-like objects in and around the cell. And then the parasite is actually transmitted when a female Anopheline mosquito bites a human, and that's shown in the picture on the right. This is a picture of the life cycle of the malaria parasite. And you can see that the parasite relies on both the mosquito and the human for transmission. The mosquito part is shown above, and the human part is shown below. Next slide. Next slide, sorry. Starting on the left above the line, a mosquito bites an infected human and ingests some malaria parasites. The parasite reproduces and is stored in the mosquito's salivary gland. Next slide. Then, when the mosquito bites an uninfected human, the parasites are passed to that human. These parasites infect cells in the liver where they're going to fully develop further. Then they are released into the blood where they infect red blood cells and multiply. Now, depending on the species, some parasites will stay in the liver for weeks or months at a time before being released into the bloodstream. Next slide. When the parasite has reproduced and matured in the red blood cell, the cell will burst, releasing parasites into the blood. Some of these parasites will be picked up by another mosquito when it bites the human. So what are the symptoms of malaria? Well, in general, they can look like any other disease. So basically, people who get malaria will usually have fever, chills, sweats. Sometimes they'll have myalgia, which is basically weakness, headaches, nausea, vomiting. So they look like a variety of other diseases. You can become very sick with malaria, and you can have severe malaria with symptoms like confusion, seizures, and shortness of breath, and these are life-threatening symptoms. Next slide. Thankfully, we have tests for malaria that can tell us whether someone is infected. Microscopy is the gold standard when it comes to diagnosing malaria because you can tell the species of infection and the amount of infection, and both of those things are very important for appropriate treatment of the disease. Here I'm showing you two types of malaria microscope slides. On the left is what's known as a thin smear, and here a drop of blood is put on a microscope slide and smeared so that only a very thin layer of red blood cells can be seen under the microscope. And then this is stained so that when you actually look at the picture, you can really tell very well whether the red blood cells are infected. And so this picture is a thin smear, and you can see the parasites in the red blood cells on the left. On the right is what's known as a thick smear. Here, you keep the drop of blood and apply a chemical that destroys the cell. And so this picture on the right is a thick smear, and you can also see parasites in that. So a thin smear is used when you want to know the correct species, because you can see very, very well, if you've done the slide well, you can see very well what the species is, and you can also see the amount of infection very well as well. And a thick smear is just used if you want a quick confirmation to see is the patient infected or not. In some places, however, microscopy isn't available or there might not be a trained technician, and so a rapid diagnostic test is used instead. And so in this picture, you can see a health worker putting a drop of blood into the test cassette, and a chemical will then be added, and this mixes with the blood. And so if a parasite is present, the chemical reacts, and a line will show up indicating that there is an infection. So this is a little bit different in that you don't see any parasites, you just get a positive negative reading. Some rapid diagnostic tests can tell the difference between some species of malaria, but usually we'll just know if the person is infected, but not with what species or how much they're infected. And so those are the two tests that are the most prevalent. There are other diagnostic tests for malaria as well. Next slide. Thankfully, not only do we have good diagnostic ways to test for malaria, but we also have very effective treatments. Usually, we'll use pills like artemether lumefantrine, which is a type of treatment, to treat uncomplicated or simple malaria. If a person has severe malaria, we will use parenteral drugs, which are IV drugs or intramuscular drugs, like artesunate or quinidine, to get that infection down very quickly, because severe malaria can become very deadly very fast. And so oral medication isn't necessarily going to help as much as an IV drug will. The treatment we recommend really depends on the species and also whether there is resistance to the medication. So for example, I don't know how many of you have heard of chloroquine, but chloroquine can be used to treat infection with Plasmodium falciparum in Haiti, but it can't be used in Malawi because there's too much resistance and it won't work, so the person will not get better, so you have to use different medications. The important thing to take away, though, is that malaria is completely curable with the proper treatment. So you don't end up having a lifelong infection with malaria. You can treat it and you can cure it. Next slide. So my advice to you, if you're thinking about traveling to a country where there is malaria, you should really see your doctor so that you know how to protect yourself the best way. Sometimes a doctor will recommend chemoprophylaxis, which is a fancy word for medication that you can take to help prevent you from getting malaria. Using personal protection from mosquito bites like repellents and sleeping under bed nets might also be recommended depending on the country where you're traveling in and even to the region of the country where you're traveling in. And of course, counseling about seeking prompt diagnosis and treatment if you do get sick is also important. So if you do come back, let's say, from Kenya and you have a fever, after a couple of days you get home, it's very important to go immediately to the doctor or to the emergency room because you can get very sick very quickly and the disease can become life-threatening. So it's important to seek that prompt diagnosis and treatment as soon as you get back. So there's actually a lot of great information for travelers on the CDC websites, and I've listed them on this slide. And we have our own website, which is www.cdc.gov/malaria. We have a lot of great tips for travelers. You can also call a hotline. The number is listed on the website, and that's available Monday through Friday, 9 to 5, where we can help you if you have questions about what medications to take, if you're traveling to Haiti versus Malawi versus Angola. So we can really help you figure out what you need to do to protect yourself. Next slide. So now that I've given you a little bit of information about what malaria is, how to diagnose it, treat it, and prevent it, I'm going to move on to some things that are being done to control it globally. And one important aspect of control strategies is the continuous, accurate, and timely counting of malaria cases, and this is known as surveillance. And knowing this information is really necessary for allocation of resources like tests and bed nets. Because if you don't know what the needs are in the community, if you don't know that number of cases, it's going to be very difficult for you to decide which community should get the bed nets and tests and treatments and which community should get less or more, depending on the needs of that community. So you really need to have a good tracking system to help you make those decisions. And then, of course, monitoring and evaluation of programs and interventions is also necessary because we need to know if our operations and our programs are actually working or if they need to be improved. So, for example, if we were to distribute bed nets during a campaign to help prevent transmission, we might want to know if people are actually using them. And if we find out that people in the community are not using them, we might need an education campaign. We might need to meet with the community leaders to see, why aren't we using these nets? They're very important to prevent transmission. So these are the types of things that we would do to help reach out to the community. Proper case management is also critical. So healthcare professionals need to have the knowledge to recognize malaria and also know how to treat it. So here in the pictures, you see a healthcare worker that's testing a child for malaria. And then he prepares the slide and reads it to see if the child is actually infected with malaria. And then on the right is a picture of Coartem, which is the brand name of artemether lumefantrine, the medication I mentioned earlier. And then that can be given to the child if he has malaria. And it's a very simple treatment. It's a 3-day course. And if the child takes it, he'll get better. Next slide. Intermittent preventative treatment in pregnancy, otherwise known as IPTP, you might hear that acronym, is recommended by the World Health Organization in sub-Saharan African countries that have a very high risk for malaria. And the reason is that malaria can be extremely dangerous during pregnancy for both the woman and the unborn baby. And preventative treatment can help reduce the chance that a pregnant woman will become infected. So this is sort of akin to the chemoprophylaxis you would take if you were traveling to a country with malaria, except it's given specifically to pregnant women in these high-risk areas in sub-Saharan Africa. One of the big control strategies that we recommend is mosquito control. And basically on the picture on the left, what you see is a mother sleeping with her baby under the bed net. And if it's treated with an insecticide, the bed net will actually repel mosquitoes, but also kill any that manage to land on it. So that's reducing the risk of infection. So you can have a bed net that maybe doesn't have any insecticide on it. It's not going to be as effective as a treated net because it's not going to kill the mosquito. It's only going to reduce the biting, but some will still get through that net. But if you have a net that's actually treated with insecticide, it's really going to go a lot further in reducing the risk because it will not only repel mosquitoes, but it'll also kill them. And then in the picture on the right, you see a worker applying insecticides to the walls of a home. And the insecticide basically will kill mosquitoes when they come to rest on the walls of the home. So again, another insecticide-based preventative treatment that helps us interrupt transmission and repel and get rid of the mosquitoes. Community education is an extremely vital piece of malaria control. Educating the population about the signs and symptoms of malaria is important so that people actually are proactive about seeking treatment. It's also important to give education about the ways that people can prevent malaria. These include the proper use of bed nets, getting tested and treated, and also prevention of malaria during pregnancy. And I'm going to show a little video here about a nurse giving information about malaria to women during an antenatal visit in a clinic in Karanga, Malawi, which is in the north of the country.
Malaria ni vichi. Wanatangana kwa malaria, ngoni ya vichi. Abe, kaya ngoni pa. Umuntu wokona. Akubeshe minutes 2. Banya overtake. Banya kubala fika bauje nejo.
Okay, so I'm going to translate for you because I'm assuming no one here speaks Chichewa. That's the actual language that was used in the video. And I had a Peace Corps volunteer that I worked with recently there in Malawi shoot this specifically for this presentation because I wanted to show everyone what actually happens when you reach out to the community. And so basically, the opening song that you saw is something that they do during every antenatal visit, and it's really meant to scare women into seeking care as much as possible so that not only do they get the normal antenatal care that you get during pregnancy, but that they also get their malaria preventative. So the song is basically, I will die, I will die, I will die. Malaria is a disease that hurts, I will die. See, my head hurts, I will die. Pregnancy kills the one who will deliver, I will die. See now my back hurts, my legs hurt, and my stomach hurts, I will die. And so the nurse opens this discussion by welcoming everybody and saying, I know that most of us know the story about malaria. Tell me, what is malaria? And so the volunteer that you saw actually answers, malaria gives you a high fever and can also cause vomiting. And so the nurse says, yes, malaria is a disease that affects all of us here, but is especially dangerous for pregnant women. So you can see how this plays out in the community and how it affects the community. And you can see that women actually do understand, and they can understand the symptoms because the volunteer gave a perfect answer. So she recognizes the symptoms of malaria. And so it's really an example of the way that we can reach out to these communities. And a great way to do that is through antenatal care, because women will come for their visits. Most women in most sub-Saharan African countries will go for their antenatal care visit at least once. So it's a great way for us to actually reach out to these communities. So now I'm going to transition a little bit into some work that I've done. So I've worked in 2 countries, in Angola and in Malawi. So first I'll start with Angola. It's located in Southwest Africa, so you can see the little dark blue highlight of the country, it's right there. And it has a population of about 19 million. It does have the widespread presence of malaria. There were 3.8 million cases and 21,000 deaths estimated to have occurred in 2012. And there were about $90 million in 2012 for malaria-related expenditures given by donors. So quite a bit of money. So what was I doing in Angola? Well, that's a great question. I assisted the National Malaria Control Program with an evaluation of a surveillance system for malaria. And so one of the important parts was going to the health facilities and seeing how healthcare workers were keeping track of malaria cases. And so basically what would happen is healthcare workers would write down the information on each malaria case seen and diagnosed at that particular facility. And it was recorded in a book. It's basically, if you remember those composition notebooks that you used in elementary school, it's a slightly bigger version of that, and it has columns for the patient's name, their age, what their symptoms were, what they were diagnosed with, and any lab tests that were done, and eventually what treatment was given. And so then a worker would actually have to go and manually count up all the cases in the patient registry and then write them on a one-sheet form. And unfortunately, as we all know, manually counting things can lead to a lot of mistakes. So what we noticed is there were a lot of mistakes in the forms, and a lot of the cases were miscounted. Now, if you remember earlier, when I was speaking about the very critical importance of actually having correct numbers for malaria cases, you really need to know the correct number because then you know how to best allocate resources. And in some instances, we had workers who the actual case count was about 130, and they were saying that it was about 1,000. So you can see a great difference in that, and these are just mistakes that we all make. And so we gave them recommendations for how to improve this system, and we looked at other aspects of the system as well, just to make it work much better for them. And so I also got to see the laboratory in one health facility. Oh, can you actually move to the, sorry, next, yeah, there I am. So you can see me standing right there in front of one of the health facilities I visited, and also looking under the microscope to see a potential slide that was being tested for malaria. Next slide. So I've also worked in Malawi. Malawi is located in Southeast Africa. I don't think you can see the outline of Africa very well, but you can see the little sliver on the southeast. That is Malawi. It's a tiny country, but very beautiful, worth visiting. It has a population of 16 million. Again, widespread presence of malaria. 4.4 million cases and 10,000 deaths estimated by the World Health Organization in 2012. And about $35 million in 2012 for malaria-related expenditures were given by donors. Next slide. So in Malawi, I helped, again, the National Malaria Control Program and the Malaria Alert Center, which was one of our implementing partners, with a drug efficacy study. And on the left is a picture of me and an employee of the Malaria Alert Center outside of one of our study sites. And on the right, you see one of our study nurses writing down information related to the study at the clinic. So remember how I mentioned that parasites can actually become resistant to medications? Well, it's important to do these types of studies. They're known as drug efficacy studies every so often, because it helps us understand if the medications that we recommend and that the WHO recommends are actually still working. Because if we find that we have a lot of people not getting better once we treat them, then we know, oh, we might have to change it to a different medication because the parasite is becoming resistant. So it's a way for us to monitor whether our treatments are really working. And one of the things that really struck me in Malawi was the difficulty that some mothers had getting to the clinic, because I was there during the rainy season, and I don't know if you've ever experienced a rainy season in sub-Saharan Africa, but it can get pretty rainy, and the roads are not in a great condition, and often they get very muddy. So these mothers sometimes had to travel great distances, and they didn't have money for transportation, so they would have to walk. And so if it got too rainy and too muddy, they would actually have to wait. And you can imagine, you have a sick baby at home, you think he has malaria, you really want to get to the clinic to get the treatment, but you can't because it's just impossible for you to actually get to the hospital to get the treatment. And so some of these mothers would have to wait and come later. And of course, again, proper case management, quick treatment, quick diagnosis, quick treatment is really critical in helping prevent malaria, helping treat malaria. So it really speaks to how the infrastructure in these places can sometimes impede people in getting the proper care, even if they know about the signs and symptoms and they know that they need to get to the hospital. Next slide, please. So the President's Malaria Initiative was started in 2005, and its goal was really to cut malaria deaths in half. And so just in 2013, $608 million was spent, and this bought 40 million insecticide-treated bed nets. 5 million homes were sprayed with insecticide. So these are the pictures I showed earlier with the mother sleeping under the net and the worker spraying the walls. And 48 million malaria treatments and 51 million rapid diagnostic tests were also purchased. Next slide. So, my conclusions, basically. For there to be no more malaria, there are several priorities we need to consider. First, there's this political priority of preventing donor fatigue. We have had a lot of financial support for malaria, and malaria funding will need to continue, especially when we get closer and closer to elimination, because continued support becomes even more critical at that juncture. And the second priority is really social, and that's to continue to improve behaviors like sleeping under bed nets and using that preventative treatment during pregnancy and eliminating standing water, so that people really decrease their own chance of getting malaria. And then lastly, we want continued support for further research, like vaccines, better medications, because we know about resistance. And these can really help us identify new and more effective ways that can help us improve control and move closer towards elimination. And so basically, malaria elimination will require continued support by donors, improved preventative behaviors by people, and continued support for future research as we move towards elimination. Next slide. So that's all I've prepared to talk with you about tonight. I'm happy to take any questions. I also have my email there, so if you don't get your question answered or you come up with something next week, you wake up at 3 a.m. and you have a burning desire to get a malaria question answered, you can email me at that email, and you can also see our website as well. So I'd be happy to take any questions.